Burgess.
Gentleman from Texas is recognized for 90 seconds.
And I thank the gentleman for yielding. I do urge my colleagues to look long and hard before voting on this rule today, and I urge a no vote on the rule. The fact is, Madam Speaker, that over half of the country has not had an opportunity to participate in this debate. 40% of this country is represented by Republican members. We have not had input into this bill. 12% of this Congress is new. They have had no input into this bill. That leaves over half the country who haven't been part of this debate. And what does it say about a bipartisan bill when the two principal Republican sponsors in the other body withdrew their support for this bill as it came through the Senate? The last night in the Rules Committee, in one last attempt, I tried to modify the bill to perhaps make it a better product before it came before us on the floor of the House today. I brought amendments that would have required identity, a person to provide proper identification before they signed up for S-chip. Not another step, but just simply another line that needed to be filled out on the form, and that was rejected. You have to show your ID before you cash a check at the grocery store. Why should we not require someone to show identification before they sign up for this benefit? I also introduced an amendment. After all, we are, as the member from Texas said, the gentleman from Texas said, we're taking 2.5 million children off of private health insurance and putting them on public health insurance. Why should we not at least ensure that we will pay the providers a sufficient amount so that they will participate in the system? Currently, it is difficult to find providers who will accept Medicaid and S-chip. I introduced an amendment that would have required 90% of the reimbursement from the federal Blue Cross Blue Shield program or the state's largest. I asked for an additional 30 seconds.
Give the gentleman 30 additional seconds.
Recognized for 30 seconds.
Last night in the Rules Committee, I introduced an amendment that would have required states to reimburse physicians at 90% of the Blue Cross Blue Shield rate or the largest state HMO rate in that state or the state the insurance that the state provides for their own employees. That amendment was not even allowed a vote on the floor. This is the type of exclusionary politics that is being practiced in the House of Representatives, and the sooner we get past this point, the President asked for a more open and bipartisan government. The sooner we get past that point, the better for the American people. I'll yield back.
Gentleman yields back his time.